Hi, I'm here with Mel from the medicine shop. Mel's a pharmacist, and he is going to be telling us about medication literacy. Hi, Mel. Thanks for joining us today.
Thank you, Teresa.
Tell us about medication literacy. Like, we're familiar with literacy with reading and writing. So what's medication literacy all about?
Medication literacy is a understanding of the medications, specifically what is it for, the best time to take, and how to take it, and possible side effects or drug interactions that these medications may shouldn't be combined with other medications. Or
do you find that these are things that most people are familiar with? Are they medication literate?
they're getting more and more familiar now because the government have programs put in place called medication reviews, where pharmacists are enabled to talk to the patients one-on-one and discuss the medications they're taking, what it's for, and that way patients are more responsible for their health, they are more compliant with taking medications, and they are more accountable for their health.
I think that it's probably difficult for some people to keep all those things straight.
Yes.
So what kind of programs are in place to help people know when to take them and all those other counterindications?
Yes, like I said, the medication review is a publicly funded program that we can do every 6 months or as often as we can, where we discuss with the patients, so patients will be informed with the medications they're taking, so they can decide for their health because of that.
So Mel, will you go to someone's home to help them with this, or will other pharmacists across Vancouver Island?
Yes, in our pharmacy, as a pharmacist, we do visit, or I do visit my patient. That way, if the patient have any questions about the medications, we will answer the concern right away. And that way as well, when we go to the patient home, when we notice that they're getting overwhelmed with all the medications they're taking, whether it is still relevant or not, or whether it is something that they should still keep in the medicine cabinet, then we will discuss that. We usually help them dispose of expired medications and just make sure that their medications are simplified. And from then we will discuss the medications one by one, what the medication is for, the side effects, and possible interaction if there's any.
Well, that seems like a really fabulous service. Is it costly?
No, for us it is part of our value-added service in our pharmacy, because we notice that especially in the elderly population, where a lot of our patients cannot come to the pharmacy. So what we do is we're bridging that gap and connecting with the community, so that we're providing the service to the patient rather than the patient accessing the service, the pharmacy services.
So yes, so just to reiterate, you actually will go there to their homes and
Yes.
work with them on the medication, even work with their family members or their caregivers, and it's free.
Yes, yes. So we don't charge our patient with that, because when we do our own prescription delivery, we will talk to our patient and just to make sure that whatever they have received, they know what it's for, what the side effects, and it's a one-on-one, so they see their pharmacist that way.
That's wonderful. And I know that another service that pharmacies do offer are blister packs or AccuPacks,
Yes.
and which makes it a lot easier for patients to take their medication.
Yeah, that is another component of medication management, where patients sometimes forget to take their medications. By doing the blister pack or the compliance packaging, that way they will physically see whether they have taken their medications or not, and they are also arranged on the time of the week or the time of the day and the days of the week, so they know we already put the medications in place for them.
Well, that's wonderful, Mel. Thank you very much for joining us today and telling us about the free programs and to help with medication literacy.